We just started in this work as a result of just seeing the gaps and actually saying, look, we need something that's going to be culturally responsive, something gender specific, something developmentally targeted to a population of people to meet the unique needs that they have and that what they present, the clinical implications that they exhibit in a treatment setting.
What we're seeing is it provides for the global culture. So it's not just one culture that we're talking about.
Right.
Because if it impacts one, it impacts everybody that is in the room. So the global culture, which we look at it as very mosaic in a sense. The beauty of this mosaic of everybody working in a collaborative, collective kind of manner and say, hey, let's sit down and talk. What can we do to make, Oklahoma a better community?
Right. This is OK State of Mind. I'm your host, Dee Harris. I'm thrilled to be joined with a guest co-host, Micah Mesker. She's the Senior Program Director from our Family and Children's Services Women in Recovery program. And today we're joined by Darryl, Turpin, and Guy Wheeler. They're international experts on criminal behavior, substance use, and mental health. Darryl and Guy are driving forces behind HEAT, which stands for Habilitation Empowerment Accountability Therapy, and HER, which is Habilitation Empowerment Recovery, which are culturally tailored group counseling interventions explicitly designed for the Black community. Currently, they're in Tulsa, Oklahoma, working with Family and Children's Services to implement programs like this in our jail and prison diversion programs, substance use disorder programs, and women's justice programs. So, welcome.
Thank you. We're glad to be here.
So, you're in from out of town. You're from Kentucky and Florida, correct?
I'm Fort Lauderdale, Florida.
Louisville, Kentucky.
Okay. And how did you guys meet, and how did this all come about, this HEAT and HER program?
Well, I think we actually met from a phenomena that's described in a book by Dr. Danielle Tatum called Why Are All the Black Kids Sitting Together in the Cafeteria? So we met at a conference. It was a treatment court conference. It was actually the first one. It was in Las Vegas. And there were very few people of color at this conference. So Guy and I just sort of gravitated toward one another. There was a lot of, energy between he and I, and we just sort of connected and started talking right away about equity as it relates to treatment. We started talking about treatment outcomes, how well are people of color doing in that model at that time that was called treatment court model. How well are people of color doing in that model? And our conversations were pretty, they were pretty deep and pretty, it opened my mind to understand that while we saw during the crack cocaine epidemic, a lot of nonviolent people of color showing up in the justice system, those were opportunities that court had to merge with treatment services and treatment, tailoring their treatment more toward meeting the needs of that population, right? Mm-hmm. So that's where our conversation started. It was like, okay, what are we doing by he and I both being treatment professionals? We were right away talking about how well are we tailoring our treatment to meet the needs of that population. And quite honestly, at that time, it was mixed. It was probably not doing so well at that time.
Particularly when it comes to access.
Mm-hmm.
Well, that was two different issues. It was retention and successful completion and access.
Right,
it was
correct.
actually a couple issues there because they weren't doing well either.
Right. Well, and access has been a barrier for quite some time. And,
Yes.
And still is.
And it still is. And what other barriers were you seeing for there to be this big divide between the treatment outcomes from Black communities and other communities?
Well, a couple things. It was just treatment at that time wasn't even tailored. I hadn't even been thought about how to effectively meet the needs. Cultural awareness, I think, was the word at that time. Cultural awareness. We moved from cultural awareness to cultural proficiency to cultural competency and all those different words. But at that stage, we were just trying to be culturally aware. And treatment at that time was not tailored.
One size fits all, right?
Exactly. Yeah. And we know, and what we've learned from the research, that when you do treatment for communities of color, the same treatment for everyone, communities of color don't do as well. Treatment for all just doesn't work. And we have that research now. So, but we knew that then.
Yeah.
Just intuitively.
Well, some of it was realistic because let me give you, I'm in South Florida. Give you a real clear-cut example. And I was having Spanish or Hispanics coming into the particular program, and they were not doing well. Now, because I'm black, I assumed that I was culturally competent, right? I just assumed it was presumptuous that, I'm black.
You would think.
I would think, but they were failing the program, right? So guess what I did? I went and asked them, what in the world, I'm the director of this particular program, what am I doing? And the guy looked me in the face, he says, Mr. Wheeler, we really like you and stuff, but why don't you hire somebody that speaks Spanish?
Wow.
You see what it was?
Yeah.
There I was. I'm speaking
so
English.
simple.
You're in America. You see my mindset?
Right.
And all I had to do was, and he just said, why don't you get somebody to speak Spanish? I hired somebody that spoke Spanish, had a master's degree, spoke Spanish eloquently, fluently. And guess what? I started retaining them. And as a result of me started retaining them, I had to look at the bigger picture look at the populations that I'm serving, and do we respect them from their culture?
Right.
I'm in this, this area where you have so many different type of cultures, and I'm trying to just feed them exactly what I think is right from this way.
Right.
But I
And
had
from
to
your
respect-
training too.
That's what I was trained in graduate school.
Right.
Okay, this is what I was taught. And here I was, is that I was not really respecting their particular culture. Once I hired somebody that was Spanish, the game changed, totally changed.
And let me give you kudos, because Guy, shortly after that, which was totally unheard of at that time, he began to develop a special treatment track for African American males.
How long ago was that?
1993.
Okay, so you've been doing this a bit.
So we were like, when he told me that, I'm like, whoa, like, really? You're doing that? I mean, that was unheard of then. I
Yeah.
mean, that was such mind-blowing, phenomenal exercise in ways of tailoring treatment for that population. I couldn't believe it. So I began to watch him closely over the years, and he probably didn't know. I was calling him regularly, getting updates on how well is that doing. But mostly it wasn't how well is the program doing, because I was wondering how well has that been received by key stakeholders that were the judges, the other professionals, the criminal justice system. How well were they receiving having a tailored program specific for African American males? Like politically, what did that look like? And because that's what I was more concerned about, because in Louisville, Kentucky, for me to develop a track like that would have really would have probably been frowned upon. But I wanted to know how he navigated those relationships in order to make that happen.
Yeah, because you had to have a certain buy-in from the system.
Absolutely.
There you go. So it became two things. I'm going to just give you an acronym, PE. It was political and economics. The political at the time, you had crack cocaine that was exploding. We were on television, bad boys, bad boys, bad boys, and they couldn't put them all in the jails.
What you gonna do?
Okay. They couldn't put them all these guys that were in the jail, and you had all of these African-American males that was coming into the particular program, and basically they said, well, we can't accommodate all of these people, putting them in jail. We need to think of another means and ways to do it.
Right.
Dade County had a particular program of drug court. I'm in graduate school at the time. I go visit them. The guy says, why don't you come up with an innovative means and ways to deal with it? And then black males were not coming into the particular program. So guess what? They were losing money. They were,
Right. And they weren't coming in because they didn't want treatment. Is that why?
Well, they didn't know anything about it at that particular time.
Yeah, because
Or they were going to jail. No, they were getting ready to go to jail because of crack cocaine or prison. So giving them an alternative with an incentive of coming into treatment.
Right.
Okay, as opposed to going to prison, that was an incentive to them to say, okay, I'll come into your particular program, and if I stay in your particular program for 1 year, I'll get my charges dropped. Well, even a criminal will think out loud and says, hell yeah, I'm going to come to you.
Well, we got to remember the time in the 90s.
That's true, too.
The solution to drug problem was to criminalize it.
Right.
So,
And that's part of the reason that we're in the situation we are right now,
Exactly.
and especially in Oklahoma with the high rates of incarceration in Oklahoma.
especially with women, yeah.
So as a result of that, all these people that were going in, so we started to say, hey, why don't you in particular come into the program? I got my case managers go and talk to them, and now they start coming into the program. And then guess what? You didn't have those people living out in tents, outside, inside of the jails. Politically, it looked very well, and then it became a cost-effective means and ways to do it on an outpatient basis as opposed to sending them all to prison at that particular point. So as a result of that is I said, let's design a program particularly with them, as well as a program for the Hispanics as well, okay? And looking out for the general kind of picture. And as a result of that, here's what we have.
It's just a different way to look at, criminalization as you say it. And we're very fast to lock people up, and very it takes us a long time to realize that there are other opportunities, like women in recovery, for example. Female incarceration was so high in Oklahoma that program was formed, and it's a diversion program that's been very, very successful because individuals that are in the criminal justice system don't necessarily get the treatment that they need. And drug court is another great example of a program that's allowing that to happen. But could you tell a difference from when you first started and there wasn't that cultural specific program that you weren't, and then now today that you are doing that, the Her example? How did it change? Did anything change? How was this born is what I'm trying to ask.
Well, we saw gaps. There were obviously gaps in services, particularly for that population, African-American males, which is where we started. We wanted to, I guess Guy and I felt that we wanted to start where the fire was burning the hottest. And at that time, young Black men involved in for nonviolent offenses were overly represented in the justice system. And they were failing miserably in treatment courts. In some places, they were reporting 9% successful completion. 9% of African-American males, 18 to 25-year-old, were completing the program successfully, 9%. So Guy and I were going around the country beating a drum saying, hey, something has to change, because basically this so-called treatment court model that's supposed to be innovative and creative is actually perpetuating the same institutionalized practices of racism toward this population as court as normal was doing. So what's the difference? We might as well just do court as normal when this model should be something different. I mean, Guy and I are not curriculum developers. That's not what we started off. That's not why we went to college. But we just started in this work as a result of just seeing the gaps and actually saying, look, we need something that's going to be culturally responsive, something gender specific, something developmentally targeted to a population of people to meet the unique needs that they have, and that what they present, the clinical implications that they exhibit in a treatment setting. So that's how we got started. Not because of wanting to start a new business or thinking it was a great idea. We were like, hey, the field desperately needs this. Simultaneously, I was on the board of directors for National Association of Drug Court Professionals. And we began to look at data. They began to do research and present data showing this glowing disparities that existed with women with people of color and with women even. But it was more glaring, particularly with populations of color, particularly the young African-American males. So it was a perfect marriage. So we started our work, and our first research was in a treatment court. Because Guy and I had years of work in that field, we began to first have this model tested in that setting. Now, it's not a treatment court model, but it fits well in treatment court as well. And by our connections and our years of work in that field, we first began to do our clinical research in the drug court. And we began to see right away that we were increasing retention, successful completion, as a result of offering HEAT as an option to programs. Now, African-American males, which were not even willing to come into program, one, and two, if they were to come into program, they didn't have services to meet the needs of that population. Now, all of a sudden, we make it more accessible.
Right. So I'm guessing at its very core is really stepping into a culture and understanding it and understanding the nuances of it. Am I correct to assume that?
And not only just culture and gender. So let me give you my own problem, particularly as it relates to women, okay? Because at one particular point, and I have to be honest, I was dealing with the crack cocaine era, right? And when women was coming into treatment, I had to look at my own stuff, my own biases. And that was a problematic for me because I was dealing with someone in my own family was on crack cocaine. And my initial reaction was, you don't supposed to be on crack cocaine,
Right.
you see? And I had to look at myself, and it was painful to me. Here I was treating, at one particular point in my initial stages of working in the arena, before we spawned off into what we started doing, I was working with obviously males as well as females and working with them. And I am the counselor working with them. And a young lady came into treatment, and I was like, my response was, what are you doing here? In front of everybody, right? True story. It's like, well, what are you doing here? Well, I didn't see the lady maybe after a month. I don't know if she was terminated from the program. I have no idea. And I'm a little still saddened by this, but this is my story. I ended up going to a clinic, and it was a HIV clinic. And I walked in, and the woman pushed me on the leg, says, hey, Mr. Wheeler. I said, hello. She says, I'm the woman you embarrassed.
Oh, man.
I'm the woman you embarrassed. And it just messed me up. It's just like, and I had to, right then and there, I'm thinking of all, and I said, you know what, ma'am, I'm sorry. I'm sorry. I just, right then and there. And so I think a lot of times I had to evolve to grow with my own biases, because that was my own stuff, dealing with my own family stuff.
Sure.
And seeing a woman with children. And I had to get past me, because my stuff was getting in the way, and how many women that could have hurt, okay, in that process. I didn't want to do that anymore, okay? I certainly did not want to do that. So I think I evolved as a result of somebody else's pain, hurt, injury, and I kept up with her after that.
Good.
And I think I resolved it, okay? But that is one of the reasons when we started to get into this particular area, I was gun-ho of getting women to come in, and we may oversee it, okay, to look at this particular concept, and they be the writers of this particular program. So that's my history and why I really wanted to get into her. You didn't know anything about that, did you?
I never heard that story.
That's
I know.
powerful.
But I have to be true to self.
But the truth of the matter is we all have biases. It doesn't matter who you are. You do. And it's recognizing that within yourself and going, really taking a hard look. And sometimes it takes those encounters for you to go, am I dealing with a bias here that isn't probably pretty? And how do I address that? And not everyone can do that. But Micah, you've taken this course, or you've been trained in Heat Her. From your perspective, what really made you interested, and how did you see this as impactful?
Well, I think it's very similar to what you were just saying. Guy and Darryl are very good about presenting information in a way that is sensitive to all cultures. And that allows you to let your guard down and really examine your own internal and unconscious biases. It's a very powerful training. I mean, you can probably tell that from hearing the way that they speak right now. The training is very much like this. And so you leave that training with a sense of personal growth and development, life improvement, new viewpoints, as well as hope that you can have a huge impact on the community. And that is one of the reasons that I left Dallas and came back to Tulsa and immediately started saying we need this here in Tulsa, Oklahoma.
Wow. So you bring up gender-based care and, women designing the program. What does that even look like?
Well, quite honestly, at least from my standpoint, I didn't want to touch it.
I love the honesty and vulnerability we have
Thank you,
going
Mr.
here.
Turpin, for being so honest here today, sir.
I honestly didn't.
Well, I
and I
don't
tell
think
you,
there's anything wrong with saying that.
Well, I mean, because I didn't think I was qualified to touch it.
There you go.
Sure.
And, I was familiar with the research that women are better equipped in delivering interventions to women. And I felt like many of those topics and subjects need to be dealt with by women.
So you felt like a little bit of an imposter stepping in there.
Exactly. It was like, okay, it needs to be done, but not by me.
Embrace the female side of yourself.
Exactly. So, but what ended up happening, we were put in a situation where we were challenged by a director out in Multnomah County, Oregon. And basically she said, the field needs this. Have you looked at the data to look at what's happening with black female incarceration, with female incarceration, what's happening across the country? And I was like, well, and basically she said, if you don't do it, then who will? And so Guy and I began to talk about it, and we agreed right away that this would be something that we would probably be more hands-off with. We would sort of coordinate the project management aspect of it, but as far as the writing and what was the content that needed to be included in this model, we wanted to be hands-off. And that's exactly what we did. We were fortunate because we had networked and connected with many brilliant women across the country. And these women were judges. We had women with life experience in the criminal justice system. We had, of course, therapists. We had case managers.
Women in trauma.
I mean, we just had a broad perspective. We have both black women and white women participating in this. And we wanted to assemble, and they just sort of had come into our space. We didn't really go actively recruiting. They just showed up. They were there. It was almost like
If you build it, they will come.
They were like, it was almost providential. They just showed up.
Yeah, that's true.
And we assembled them together. And let me tell you, those women probably developed one of our best models. I'm even willing to say our best model. We have 4 different models. Our women's adult model, I think, is probably our best model.
Will you just talk a little bit more deeply about what the models consist of?
So, of course, we started off with African-American men age 18 to 29-year-olds. So because 18 to 25, 18 to 23-year-olds were the ones that had the highest rates of recidivism, least likely to successfully complete treatment, least likely to engage in treatment. I mean, they were the most likely to be arrested. I mean, it was the rates were very high. So we wanted to go where the fire was burning again, the hottest, and the heat. That was heat. And while we respected the hospital, we wanted to go to the emergency room, and we felt like that was the population that was in the emergency room, not disrespecting other populations that were in the hospital. So we started off there, and right away, because of my work with juveniles for years, Guy and I began to look at the data in the juvenile system. It's even more horrendous. The disparities are even more blatant in the juvenile justice system. The foster care to prison pipeline is just it's horrible. It's horrific.
And that's really where you can break the cycle.
Yes.
I think you get more bang for your buck there. I really do, by starting early. So right away, as soon as we had established that model, our adult model, we went right into African-American male adolescent populations. Shortly after that, that's when we were challenged with the women. We assembled these women together and we developed the HER model, Habilitation Empowerment Recovery model. So we ran with those 3 models for a while. HEAT for youth, our adolescent model, was being used as a violence prevention model. There were cities in the United States that had high rates of homicide, gang involvement, and other violent offenses. Birmingham, Alabama being one of those. The mayor of Birmingham decided that one of his violence prevention strategies would be to implement HEAT for youth in every school in the city of Birmingham.
Oh, wow.
Yes.
So we were very excited about that. So we went right to work right away, training these facilitators, getting them ready for school to deliver this intervention in every middle school and high school in the city of Birmingham. But when the school got wind of this, and of course we had to have their buy-in to make this part of their school curriculum, the school staff said, hey, we need to address the homicide and the violence in the community. But in the school, our most violent and most at-risk group in our schools are girls. And
That's
we were like,
so interesting.
So we were like, well, and they said, can we use the boys' model for the girls? And we were like, no, it's a very gender-specific model for adolescent boys. They said, well, if we're going to do this, if we're really going to have an impact, we got to do something. I mean, there were girls, there were stabbings, assaults, to the point of bloodthirsty interactions that were going on in these schools that were mostly committed by girls. And the school, the staff at the school insisted that we had to have something for the girls. So the mayor's office worked with us and said, hey, y'all got to get something for the girls. And so, again, we took the same approach as we did with the women's model and assembled professional women who had worked with girls before, and we developed Her for Girls. That model was just implemented last fall in the Birmingham Public Schools, and they're having phenomenal. As a matter of fact, they have more girls in the girls program than they do the boys, and they're having amazing, phenomenal success with it. So we're very excited about that.
Yeah. So I'd like to know just a little bit about what the program looks like. I mean, what does it look like if you, in a week, in a day, in a month? How long does it last?
Go ahead. You're good at that.
Well, our adult models are longer. Guy and I really wanted to implement what we want to adhere to best practices. And much of the research supports that the longer you have a person engaged in a therapeutic process or a therapeutic intervention, the more likelihood of successful, better outcome, ongoing recovery. So we wanted a longer program. So our program is 9 months for the 36 weeks for the men, 34 weeks for the women. Don't ask me why one is 34, one is 36. Remember, the women developed that women's model.
We don't have no control over it.
And we said, well, can you make it 36 weeks? They said, no, it's 34 weeks. So we just threw up our hands.
And you don't ask those questions.
No, I did not argue. So the women's is 34 weeks, the men's is 36 weeks. It's designed that you have clinical contact. It's designed, if you use it as prescribed, it's 3 hours per week of intervention. So it's a cognitive behavioral intervention. So it's you have a facilitator guide delivered by the facilitator, and then each participant has a workbook. So it's twice a week, an hour and a half each set, 90 minutes each session, a total of 3 clinical contacts a week.
Gotcha. And that's, you were talking about the longevity. Like Women in Recovery has been very successful because it's around an 18-month program, right?
Yeah, you
Yes.
probably have better outcomes because of that.
And, I wanted to talk, you're in Tulsa because you're doing a training with Family and Children's Services. And so, Micah, tell us how this all kind of came about and what this week has been like with Guy and Darryl.
Oh. So this started whenever I was fortunate enough to be invited to attend their training down in Dallas, Texas by Kim Duran. And she invited a couple of our staff members, and so I got to be one of them. I went to the training honestly not knowing what to expect.
Yeah, and she sat on the front row.
I
did.
That's very bold of you.
Yeah.
Being an
She sat on the front
overachiever,
row. That's
right?
how we know.
I think she
She's
second-guessed
that
herself.
student.
when she did it.
I'm that person. But I'm glad I did because I was able to develop this relationship with the two of you.
Yes.
And I've really benefited from having it. So, like I said earlier, attending that training was really life-changing and transformative in the way that I started thinking. So, I mean, I knew within the first couple days, even maybe the first couple hours, I was like, we can definitely benefit from this at home. It runs the gamut from like personal development, behavioral development, to families, to community, and then even like the socio-political level of things. And that's one reason I am so impressed with it, is that it addresses multiple things that impact the individual and our community. Growth and becoming hopefully more harmonious in the long run. And so I attended that training. I came back and I knew right away that really wanted to advocate for this training. It's been a little bit of a process, but I am thrilled that Family and Children's Services brought them here. Having them here has been wonderful. And I hope we keep that partnership going.
Well, let me say this about your agency. I don't know how you selected these folk to come to this training this week, but they have been phenomenal.
Yeah, I have to give them credit.
This has been one of the most phenomenal, because usually our trainings we do heat or hair. We don't usually do them together. You came to one where we did do it that way. We typically don't do it that way. And actually, I don't like doing it that way because it's very exhausting, quite honestly.
It's intense, for sure.
It's very intense.
Very intense.
And about time we leave at the end of the week, we're wiped out. We're exhausted. But let me tell you something. You all, I give you all kudos to the Family and Children's Services because you have assembled, obviously you have a great team of people, and the folks you have assembled to be a part of this has been absolutely amazing. It has not been draining.
No.
It has been very interactive, very well received, they're very engaged.
Wow.
I mean, it has been a growth because we grow also when we do the training, when we come in contact with professionals in the field. We have an opportunity to grow, and we've grown as a result of this experience. And then today, to cap it off, we were able to experience as a training team, all the trainees and ourselves were able to attend the Greenwood Tulsa Massacre Museum, and it was just unbelievable how the work we have been working on, discussing all week, and then having that experience together, how it all just meshed together and made it even more amazing.
That's powerful.
And it was very powerful. And you've got, it really takes a special group to be able to, I mean, these folk walked in, sat down, and right away we knew they were getting it.
Well, bringing culturally responsive programs just like this to Tulsa at this specific time, I think is critical. I mean,
And I must say, that Amy Leopard person,
Amy, oh my God.
she is a gem.
She's Joel, no question.
She is a gem. She has been
What?
an amazing host.
Yes.
And right away, she set the standard of what this was and what this was going to be.
The time and everything.
I mean, how even we were going to be professional, we're going to be on time, we need you to be attentive, and then how she has made this training experience for us. Because again, this could be exhausting, but she has made so accommodating.
That's been great.
And I think from her standpoint of being a trainer herself, she's really been sensitive and very much just a great host.
Proficient and professional.
And she's been amazing. So this has been a great experience for us. So we're really glad
well,
to be
I'm
here.
so glad. That's very nice for you to say all that. I appreciate you letting us know, and I'm glad that it has been a good, because I know the work can be exhausting.
Oh, yeah.
And let me add something that we probably should incorporate. We use the term HEAT is really Habilitation Empowerment Accountability Therapy. And when we start talking about habilitation, we take into consideration what has always been missing. When we talk about rehabilitation, it has always been from the 1960s that somebody who went into treatment that already had the gifts. Everything was already taken into consideration.
Yeah, they had skills and capacities already.
They had them already. But we recognize that a lot of these gaps have been missing. Okay, the family structure has totally changed.
Yes.
Within the last 30 to 40 years. So we have to take that into consideration because even the basic manners, how you go about it, how you handle stuff is totally different. So we're talking about going back to the basics.
Well, I think that's critical because I'm sure the model begins to adjust as the world changes too.
And it has changed over the last 30 to 40 years, even as the treatment modalities start to change. So once we start to look at that, they certainly needed the skills to survive in this present world. And habilitation is something that's starting back from the basics and build them up to where they need to go.
That's great.
That's why we utilize the term habilitation empowerment. And it's also accountable. You notice that when you put the A in there, it's not as though we are patty caking them. We want them to be held accountable for their behavior because we want them to be productive citizens back in Oklahoma. Right. Again, to give back to their community.
Yeah, and I think the impact, I mean, just having this model here, bringing it in through the women's justice programs in our jail and diversion programs, you've seen that happen in other cities too. I mean, we are ground zero for the Tulsa Race Massacre. There's a lot of cultural divide in this community. There's a lot of cultural hurt that needs mending.
Absolutely.
So, can you project kind of what you can see based upon your experience in other cities, how this could change the systemic problems that we have here?
Well, I think it really begins with honest dialogue. Heat allows that. Heat doesn't negate the fact that trauma, not only just trauma through the ACEs, adverse childhood experience trauma, but we're talking about historical trauma that's been generationally passed on. We're talking about trauma, race-based trauma, Black trauma that is experienced, and have an honest conversation about that. Part of the curriculum identifies that and accepts that and has discussions about that. And I think that's really where the healing really has to begin, through honest dialogue with addressing it and not sweeping it on the rug. And I think one of the things that has been even more devastating than the massacre itself is how this community has swept that issue under the rug, not even discussed it, not even acknowledged it. And as a result, the trauma is permeated where the wounds are deep. I mean, many of the participants that we were talking to today in the training were actually African Americans who grew up in Tulsa, many of them even growing up in North Tulsa, and had family members that were part of that experience. And how they talked about, just recently, we've even started to have this conversation about the massacre.
Yeah,
and I'm like,
it's just recently been part of the dialogue.
So those conversations need to be held, and I think that's a beginning. And I think what HEAT really does is allow the identifying the racial trauma, the generational trauma that's been passed down generationally, begin to have a conversation about that. Now, not thriving in it, blaming, waddling in it, but understanding, having an honest conversation about what happened and how communities have been impacted. And then what can we do to help change and grow the community to address social determinants that make our community unhealthy and unsafe, and having even the participants in the model being a part of that. How do we create a healthy and safer community in Tulsa? HEAT is allowing these participants in this model, in this intervention, to have those kind of discussions. You are the leaders we've been waiting for. We're not waiting on the government to change us. We're not waiting on programs to change us. The leaders that are going to change and heal this community are actually going to be sitting in the HEAT groups.
Wow.
And they're the leaders we've been waiting for. So let's empower, let's educate, and let's, the E in HEAT is empowerment. Let's empower them to be the soldiers, to be the leaders that we have been waiting for to help change and make our communities healthy.
And the beauty of this is that what we're seeing is it provides for the global culture. So it's not just one culture that we're talking about.
Right.
Because if it impacts one, it impacts everybody that is in the room. So the global culture, which we look at it as very mosaic in a sense. The beauty of this mosaic of everybody working in a collaborative, collective kind of manner and say, hey, let's sit down and talk. What can we do to make Oklahoma a better community?
Right. Well, communities are mosaic.
Right.
And the more we can cross those lines and have honest conversations,
Right.
the more that we'll have a better
So
understanding.
that's what we're seeing, that even when we went to the museum, everybody was impacted.
Right.
Everybody. It was not just one segment, it was a whole group. So when we're sitting down talking to them, when they're all coming back together, everybody's emotional. The issues that we're talking about, it's not just one particular group, it's the entire culture. And that's the beauty of having this working together, because now a lot of them can look at themselves individually and say, you know what, this happened in my family.
And you know what? One of the white therapists that was at the training came to me individually and pulled me to a side. He said, my grandfather was a part of that.
Really?
And he was white. And he was a part of what happened on the Greenwood district.
So did he feel shame? Was he addressing any of that?
I think what has to happen, and what we talked about, is how do you move from awareness to feeling shame to understanding and empowerment to be anti-racist, if you will, as a white Caucasian, not just feeling white guilt. That's not helpful.
I agree.
That's not helpful to feel white guilt. I mean, that's a normal reaction. I get that. But how do we move that to understanding? How do we move understanding into action and becoming anti-racist, where you can become an advocate for change and healing? And that's what we talked about.
That we all grow.
Right. So, Micah, all the individuals that were trained this week, what are they going to do next with this information?
Well, we are certainly going to implement it in our various programs. So Women in Recovery is going to implement it in our phase program. We've already, in fact, one of our team members who attended, Erica Jackson, came back and she already had a plan on how we could integrate it into our program.
She's on fire.
And that is something I've been pondering for like the past years. Like, we need this. How do I work this in the thing? So we're going to create an additional track for women of color to run parallel with some of our other programming. And they will do the majority through their second phase. And then near the end, they will have the community module separate from the rest of it.
Okay.
And that will be the closed group part of things.
One thing I would suggest, I wouldn't just make it race-based. This is culture. This is a culturally responsive curriculum.
Thank you.
Now, this culturally for Black culture, but there are white participants that could also benefit.
Very well.
That I will, on a case-by-case basis, make a recommendation that they could also participate.
I think that's
we've
great.
had we've had
fantastic.
white, we've had Hispanic populations that have greatly benefited. As a matter of fact, our first study that we did,
That's true.
it was a white participant in the program, and SAMHSA funded the program, and they wanted to focus. We wanted to focus on African American populations, black men.
And I bet it would help Native Americans as well.
Oh, absolutely. I've had several tribal nations who have been inquiring. So far that I know of, actually, we have one lady that was trying to take it to women. The lady in St. Louis that moved to a tribal nation in Washington. I need to call her to see how that's going. But that I know of. That's the only tribal nation I know it's been implemented. But what we discovered was my phone number had been passed around the jail.
Oh, how fun for you.
And people were calling me. I had all types of phone calls because these guys knew that if they got into the research model project, they got out of jail. Because we were going to deliver it on outpatient.
Get out of jail free card.
And my number was being passed around. I was getting all kinds of phone calls. So it was this one guy, his name was Robert. And Robert says, "Yo, come see me, dog. I heard about this heat. And, I want to get in the program." I said, "Okay, I got to do an assessment. If you meet the criteria, we'll get you out." "Well, does that mean I get out of jail?" "Well, if you qualify for the program, yeah, we'll do what we can to get you out. I'll come and see you next week." So I went to see the guy, and I went to the to the staff and said, "Hey, I'm here to see Robert, do an assessment." And they said, "Yeah, there he is right there." And I said, "No, I'm looking for the Black Robert." And they said, "No, that's the only Robert we have." And Robert walks up and goes, "Yo, what's up, Mr. D? I'm glad to see you, man." And I said, "Oh,
It's a true story.
Robert, you are white."
It's a true story.
So, the guy was very enthusiastic. He was, he fit all the clinical criteria he fit.
It was great.
And I said, "Look, Robert, I need to be honest with you. This program, because of the study we're doing, we're looking for African-American males. But if you want to be in this program, I will not deny you. But I'm just telling you what it's for." Okay? And he was like, "Yo, Mr. D, most of my friends are Black. When I got high, that's who I got high with. My girlfriend, I live in a Black neighborhood. I'm cool with the culture, man. Let me in."
Cool.
And Robert did very well in the program. Robert went through the program.
Very well.
And ended up, when we had graduation,
That's right.
the Black men in the program selected him to be the graduation speaker.
That's correct.
Oh, that's awesome.
And he's a white guy. And he did very well in this program and actually found out his grandmother that showed up to the graduation that he came from affluence.
Oh.
That his grandmother, that his family was one of the most upper crust, wealthiest, affluent families in that county.
Interesting.
And it turned out to be great. So, we have had a lot of success with white participants in the program, Hispanics, and would love to see Native Americans. But it's cultural Because I don't even believe, Guy, and I don't know if you agree with this, but I don't even think all African Americans could fit in this program.
Oh, I agree.
It's cultural.
Sure.
It's totally cultural.
And it's not race. So we're not just putting all black people in the program.
No, got it.
That's not it. That's not clinical criteria.
No.
It's a certain cultural aspect that if they fit and they relate to, then that's the criteria.
Now, let me give you something parallel. It's like Motown, okay? You can dance to it, okay? Because every culture can dance to Motown, all right? Every culture. And if you can dance to it because that is the lingo, the language, the understanding, the clinical kinds of implications, the interventions that speaks to your heart and mind with a cognitive behavioral therapeutic kind of concept, utilizing all of the Freud and the Erickson and all of the clinical stuff we certainly utilize with that cultural kind of Motown that everybody can be included as well as on the dance. Therefore, as a result of that, people are dancing to it and coming out with much better outcomes. And hold it before you say something. You got to also look at it from a continuity of care. We're also doing this and talking about in prisons. We're also talking about doing it in jails, reentry. One of our first ones.
Even residential.
There's your access piece.
There you go.
Yeah.
Well, I love that metaphor.
Have you heard of Barnum and Bailey?
Okay, go ahead.
Yeah.
Have you been to the Barnum and Bailey circus?
Of course.
It's a great circus.
I'm a fan of the elephants.
I grew up on Barnum and Bailey. Very entertaining. But later, I discovered that there was a soul circus.
Oh, is it similar to the Soul Train?
Well, yeah, that's another good metaphor because I loved American Bandstand. I mean, Dick Clark
We grew up
was
on
probably one of the most progressive guys at the time because he brought a lot of African American artists to American Bandstand. And I loved Dick Clark, and I watched it every Saturday. But when Soul Train came,
Whoa.
Dick Clark came secondary.
So my favorite was Soul Train and the Flip Wilson Show. Just saying.
Okay, we understand. The beauty of it. That's fine.
But let me tell you something. You haven't seen a circus until you go to the Soul Circus.
That's true.
Okay, I'm going to have to look that one up.
Absolutely.
Okay.
So it's just, do you want to listen to Barry Manilow or do you want to listen to Tupac or Kendrick Lamar? It's kind of like
Michael Jackson or whatever.
Yeah.
Yeah, you're old, man. Michael Jackson.
Oh, good. So
So
everybody's included.
Let me ask, what is next for Heat and Her? And what is next for you two?
Retirement. No. I don't know. We've got a lot of more work to do. People are still asking the question, why do you even need these type of interventions? And unfortunately, we're still having to answer that question. We got a lot of more. Heat is now kind of a boutique program in many places. Now, we're working with places like Michigan, Missouri, Sonoma County, and Oregon. There are a few places that are trying to make it more accessible systemically. Right now, for the most part, Heat is a boutique, meaning we offer a small little boutique over there with a few clients, and for many jurisdictions, just checking a box. Like, okay, we are culturally aware, and we've got that Black program over there, and we're checking the box that we are dealing with equity and inclusion. And that's a good start.
Right.
And we've got a lot of good research from those type of boutique programs. But I want Heat to be a part of the menu. I want when you got a client that walks in the doors of Family and Children's Services, that Heat is one of the options of services that they get delivered for whoever walks in the door. I want it more systemically available to whoever needs it, no matter where they are on the continuum. And we're not there yet. So I want to be more involved in systems change. I want to be more involved in addressing the barriers and make our system more equitable, meaning that everyone has a right for good treatment services that are tailored to meet the needs, the individual needs of that person. And how can we change the system to make those type of services available no matter where you are in the continuum is really where I think we need to go.
I think you just stated a manifesto. Guy, how do you feel?
I love the idea of the systematic, all right? But I think what separates us from anybody else, and that's the biggest question, because somebody's going to ask you the question is, what are you different?
Why are
than
you
anybody?
special?
Why are you so special? And I think one of the reasons that we're so special, first of all, we allow the individual to look at themselves And once they end up looking at themselves, because that's where the evolution starts. The real evolution is we want them to look at themselves so they can be held responsible. Despite all the issues that we have in America and everything else, we still got to get to take a look at self. What do I need to do based upon what I am addressing, the issues that I'm dealing with within my own family? How about the issues that I'm dealing with in myself? How about the enemy that's within me?
Yeah.
Because once you start confronting the enemy that is within me, they can start addressing the enemy on the outside.
Right.
So those are the type of self issues that we want them to deal with. That's what separates us. The other idea is the idea of family. A lot of the populations that we're serving, that's whether it's coming out of prisons, jails, reentry, some of the issues that's going on in the family is traumatic.
Oh, yeah.
It's chaos. It's a lot. Let me tell you, in the room this week, there's an enormous amount of pain. Mm-hmm. There was so much pain, father issues,
Mother issues.
All right. And hearing so much trauma that I don't even want to go into the details of the sexual issues that's going on with a lot of these ladies that's happening in their lives.
Yeah.
And that is very painful to us.
Yeah.
Very, very painful. And we're going to have to address this. We cannot hide behind the bush any longer with some of the issues that these women are going through in America. All right. So this, the trafficking and all this is involved as well. The drug usage, incest, rape, all these types of things. We're going to have to be much more sensitive about these kinds of issues because we're dealing in America right now, particularly with the population we're talking about between 14 and 24, the suicide rate has increased.
It is.
Oh, yes.
Yeah.
Yes. Thank you for bringing that up.
Go ahead.
Because you were talking about trends, staying abreast to issues with
Well, and
African-American.
youth black suicide is up too.
It's amazing. Suicide rate is off the charts. And the question is, why is that happening? What has been the impact of gentrification, removing community protective factors where families are now being removed, isolated? What has been the impact of that?
I think that's one little tiny piece of this.
Mm-hmm.
And I think we have to start addressing suicide. Also with African Americans that we're seeing, Guy talks a lot about this, is drug of choice.
Mm-hmm.
We're seeing drug of choice with African American populations that we've never seen before. There were certain drugs that black populations didn't use.
It's true.
Those we saw with white populations, but we didn't. Now all of a sudden, we're seeing drug of choice changing to where there's no longer a drug that predominantly whites are using or blacks are using. It's like
Across the board.
Across the board. So we're seeing suicide, suicidality, and drug of choice, overdoses, which we're not paying attention to, the fentanyl overdoses with black populations, off the chart. And those are the kind of things we have to pay attention to, these trends that we're seeing differently than we did even 10 years ago.
Yeah.
As a therapist 10 years ago, some of this we didn't even see. We didn't see suicide rates 10, 15 years ago with black populations. It was not even thought of. But what's going on in our community to make those things happen now, and the drug of choice and the overdoses?
And the number of women going to prison.
That part.
Okay, because the family structure changes.
Right.
I mean, we just have to be kind of sensitive to that. And I honor you guys for having the chutzpah to take a very serious look at it.
What?
I said chutzpah. I certainly use that word. I'm allowed to use that.
Yes, you are.
Can we say that on there?
I, well, I'll bleep it out later.
No, it's really what you said. The continuum of care. And it ties into what I said about systemically. I think we're going to have to look at prisons, because one of the problems is people who need this don't have access to it. Mm-hmm. So how do we make this more accessible? So I think we're going to have to think broader in just doing more than just outpatient services or residential. We're going to have to go into the prisons. We're going to go into jails, halfway houses. I think the continuum of care piece to the systemic piece is a vital piece. So I just want to make sure that as you all are thinking about implementing this, that you think about this from not just a systemic, but also to make sure the continuum of care is being addressed with this. So,
And I would like to see community mapping. You need to get the entire community involved with this.
oh yeah,
All right? Because if you get the whole community involved, drug usage, the mental health issues that they're dealing with as well, why isn't connected to the YMCA, Faith Farm, places of residential? Everybody needs to be connected. The church, mosque, synagogue, the entire community needs to be involved because our community is involved. Our families are involved. These women are involved. These men are involved.
And that's who
So
they
not
belong
when they're
to.
doing- That's who they belong to.
they belong to the community. They don't belong to programs.
That's correct.
Right? So getting the community involved, you're absolutely right. Getting the community involved, maybe even developing an advisory board and having clergy, business owners, advocates, social justice people, survivors, and people who invested into healing the community on a part of the advisory board, not only to get advice and to help guide some of the initiatives, but also get the support from the community that, hey, this may be something that could help heal our community. And having the people that you're representing a part of that serve as an advisory capacity, I think would be a vital part.
And get them skills as well. If these guys going into the courts, get them skills because if they don't have skills, I spell skills S-K-I-L-L-S. But if you take the two S's off it, they're going to get killed.
Nice.
So put him in front of the courts and say, hey, let this guy get his GED. Let's get some skills because if he can be placed in a position of ownership that he owns something,
Right.
he owns his own business, then he has something to give back to the community.
Exactly.
So get them trained to do something.
Well, we have some work to do, and I'm excited that we have this tool in the toolbox to help us do that work. Thank you guys so much today, and safe travels.
Thank you.
Thank you.
Thank you. Kudos to your agency, Family and Children's Services, for inviting us and having the, what'd you say, the
Chutzpah.
The chutzpah.
I'll have to
And
bleep
your
it out
boss, Miss
later.
Are we gonna
Mimi,
bleep
Miss
that out?
Mimi, you gotta say, to give her credit.
for doing this. No, really, it takes a lot of courage to do something like this.
Thank you as well.
To transform a community in the way that you have done and invested. Kudos to you. And again, thank you to your entire team that has made us feel
Miss
welcome.
Mimi, we got to make sure we give her credit.
Oh, that's absolutely
She's
Mimi.
been awesome. She has been awesome.
She has.
We just want to
High
make sure
five,
we give her
Mimi.
credit.
Woo!
Oh, let's go.
Absolutely,
I better 5 her.
Absolutely, absolutely.
I'm not going to give you 5.
Okay. Well, thank you all so much. And if you come back to Tulsa, we'll have to speak again. There's 100 other things I'd like to discuss. Thank you for tuning in. If you found value in what you heard today, there are a few ways you can support and stay connected to us. First, be sure to hit that subscribe button whenever you're listening. Subscribing ensures that you never miss an episode, and it's completely free. And it also helps us continue bringing you quality content. Consider leaving us a review. Your reviews not only make our day, but they also help others discover the podcast and join our community. Share this episode with your friends, family, or anyone who might find it interesting. Word of mouth is a powerful way to grow our podcast family, and we truly appreciate your support. We're always eager to hear your thoughts, ideas, and suggestions for future episodes. Visit okstateofmind.com for all of our episodes. And you can also email us at communications@fcsok.org with any episode ideas or questions. We'd love to connect with you. So thank you once again for accompanying us on this journey. Until next time.